I want to show you something today that may finally explain why your blood pressure refuses to improve, even though you take your medication exactly as prescribed. Many people do everything their doctor tells them to do. They take their pills, they avoid salt, they check their numbers, and yet the readings stay high, or they go down slightly, then creep right back up again. What most people don't realize is that one small daily habit can quietly interfere with blood pressure control even while everything else looks correct. Recent research published just weeks ago uncovered 5 common mistakes people make when taking vitamin D. And one of these mistakes, the most overlooked one, can quietly raise blood pressure by 15 to 20 points over time. This matters especially after 60 because vitamin D is not just about bones. It plays a direct role in how your blood vessels relax, how calcium is handled in the body, and how your cardiovascular system responds to stress. Over the years, I've seen many older adults taking 3 or even 4 blood pressure medications who were unknowingly making these exact mistakes with vitamin D, not because they were careless, but because no one ever explained how vitamin D actually works inside the body. This is not something you see advertised. There is no commercial benefit in teaching people how to take a low-cost supplement correctly. But the research is very clear. One large study published in a major cardiovascular journal followed more than 15,000 adults for 8 years. It found that when vitamin D is taken correctly, blood pressure can decrease by 10 to 14 points on average. That is comparable to adding another blood pressure medication. Except this approach costs very little and works with the body instead of against it. By the end of this video, you will understand the 5 most common vitamin D mistakes. You'll see why one of them can completely block the cardiovascular benefits vitamin D should provide. And you'll walk away knowing exactly how to take vitamin D properly starting tonight. Let's begin with mistake number 5, because almost no one talks about this one, and it surprises nearly everyone who hears it. Mistake number 5 is taking vitamin D without vitamin K2. This is not a minor detail, and it's not optional. Vitamin D increases calcium absorption from your diet. That's helpful for bone strength. But calcium must be directed to the right place. Without vitamin K2, calcium can settle in areas where it does not belong, including the walls of your arteries. Let me explain this with a real example. Thomas was 71 years old. His doctor discovered his vitamin D level was low and recommended supplementation. Thomas followed instructions carefully. For 5 years, he took vitamin D every single day. His blood levels improved, but his blood pressure did not. In fact, it slowly increased over time. Later, imaging showed significant stiffening and calcification in his arteries. His cholesterol was normal. His blood sugar was stable. And yet, his arteries had become rigid. What was happening was never explained to him. Vitamin K2 activates specific proteins that guide calcium into bones and keep it out of blood vessels. Without it, calcium has no clear direction. Over time, it can settle in artery walls, making them stiffer and less flexible. This stiffness makes it harder for blood to flow smoothly, which pushes blood pressure higher. Once Thomas added vitamin K2 to his routine, the situation finally made sense. This is why vitamin D should never be taken alone. It must be paired with vitamin K2, specifically the MK7 form, taken together at the same time. Now let's move to mistake number 4, which explains why many people take vitamin D for years and still remain deficient. Mistake number 4 is taking vitamin D without enough fat for proper absorption. This is one of the most common reasons people stay deficient even after months or years of supplementation. Vitamin D is fat soluble. That means it cannot be absorbed properly unless it is taken with fat. Without fat, most of the vitamin D you swallow simply passes through your digestive system unused. Let me tell you about Patricia. Patricia was 69 years old. She had been taking vitamin D every day for nearly 3 years. Her doctor had prescribed 2,000 international units daily. She never missed a dose. Every morning, she took her vitamin D with breakfast, a slice of toast and a cup of black coffee. When her blood work was checked a year later, her vitamin D level had barely improved. It went from the low 20s into the high 20s. Still deficient. Her dose was increased. Another year passed. The level improved slightly but never reached the optimal range. Patricia was frustrated. She was doing everything right, or so she thought. The problem was absorption. Her breakfast contained almost no fat. Without fat, vitamin D cannot enter the bloodstream efficiently. But research shows something even more important. Not all fats work the same way. Studies now show that vitamin D is absorbed best when taken with omega-3 fats. These fats do more than help absorption. They also reduce inflammation and improve how vitamin D receptors function inside blood vessels. When Patricia changed one simple thing, everything shifted. Instead of taking vitamin D with toast and coffee, she began taking it with a small amount of omega-3 fat. 1 tablespoon of fish oil. Within 3 months, her vitamin D level rose into the optimal range. And something else happened. Her blood pressure, which had been stuck in the high 150s over 90 range, began to fall. This is why taking vitamin D dry with water or with a low-fat meal dramatically reduces its effectiveness. If fish oil is not tolerated, other omega-3 sources can help. Walnuts, flaxseed oil, fatty fish. The key is consistency. Vitamin D needs fat, and for cardiovascular benefits, it needs omega-3 fat. Now let's move to mistake number 3. This one surprises many people because it involves the actual form of vitamin D most doctors prescribe. Mistake number 3 is taking vitamin D2 instead of vitamin D3. On the surface, this sounds insignificant. Both are labeled vitamin D. But biologically, they behave very differently. Vitamin D3 is the natural form your skin produces when exposed to sunlight. Vitamin D2 is synthetic and behaves differently in the body. Let me tell you about Robert. Robert was 68 years old. His vitamin D level was very low, and his doctor prescribed a high-dose weekly vitamin D supplement. Robert followed instructions exactly. After several months, his blood levels improved. Technically, they were now in the normal range, but his blood pressure had not changed at all. Here is what neither Robert nor his doctor realized. Prescription vitamin D is almost always vitamin D2. Research now shows that vitamin D3 is far more effective at raising and maintaining blood levels. It stays in the bloodstream longer. It binds more efficiently to vitamin D receptors. And most importantly, it provides much stronger cardiovascular benefits. People taking vitamin D2 often see little or no improvement in blood pressure, even when their blood levels appear normal. When Robert switched from vitamin D2 to vitamin D3, everything changed. Within months, his vitamin D level stabilized at a higher, healthier range. And soon after, his blood pressure began to decline. This is why checking the label matters. If the bottle says ergocalciferol, that is vitamin D2. If it says cholecalciferol, that is vitamin D3. For heart and blood vessel health, vitamin D3 is the correct choice. Now we move to mistake number 2. This is the mistake that gives people false reassurance. Mistake number 2 is taking a dose that is too low for cardiovascular protection. Many doctors prescribe vitamin D doses based on bone health alone. These doses are often enough to prevent severe deficiency, but not enough to support blood vessel function or blood pressure regulation. For bone health, a level in the low 30s may be acceptable. For cardiovascular health, it is not. Research consistently shows that meaningful blood pressure improvement occurs when vitamin D levels are in the range of 50 to 70 nanograms per milliliter. Most people cannot reach that range with 1,000 or 2,000 units per day. They need more. When people raise their vitamin D level from deficient to truly optimal, systolic blood pressure often drops by 8 to 12 points on average. But this only happens when the level reaches that higher range. If your level is hovering in the low 30s, vitamin D is not doing its full job. And now we arrive at the most important mistake of all, the one almost everyone makes. Mistake number 1. Mistake number 1 is taking vitamin D at the wrong time of day. This is the most dangerous mistake, the most overlooked mistake, and the one that can completely erase all the blood pressure benefits vitamin D should provide. Almost everyone makes this mistake. Let me explain why. Most people take vitamin D in the morning. That's what the bottle says. That's what doctors often recommend. It feels logical. But new research shows this timing is exactly backward for blood pressure control. Let me tell you about Harold. Harold was 74 years old. He had high blood pressure for more than a decade. He was taking 3 medications and still struggled to keep his numbers under control. When his doctor found a vitamin D deficiency, Harold did everything right. He took vitamin D3, not D2. He added vitamin K2. He took it with fat. He increased his dose until his blood level reached the optimal range. And yet, his blood pressure didn't improve at all. Then Harold participated in a clinical study. Nothing about his dose changed. Nothing about the form changed. Nothing about his diet changed. The only difference was timing. Instead of taking vitamin D in the morning, he took it at night. Within weeks, his blood pressure began to fall. Within months, it dropped enough that his doctor reduced 1 medication. So what changed? Timing changed everything. Vitamin D is not just a vitamin. It is a hormone. And hormones interact deeply with your circadian rhythm, your internal day and night clock. When you take vitamin D in the morning, it sends a strong signal to your body that it is daytime. This activates your sympathetic nervous system. That is your fight or flight system. Your heart rate rises. Your blood vessels tighten. Your blood pressure increases. This is normal during the day. You need higher pressure to move, think, and function. But here is the problem. When vitamin D is taken every morning, day after day, it keeps the sympathetic system partially activated even at night. Your body never fully shifts into repair mode, and your blood pressure does not drop the way it should during sleep. This nighttime drop in blood pressure is called nocturnal dipping. Healthy people experience a drop of 10 to 20% while sleeping. This dip is essential. It allows your heart and arteries to rest. When nocturnal dipping does not occur, cardiovascular risk rises sharply. Heart attacks, strokes, heart failure. The research shows that people who take vitamin D in the morning often lose this natural dip. But people who take the exact same dose at night experience the opposite. Their blood pressure drops more deeply during sleep. Their arteries relax. Their cardiovascular system repairs itself. Over long-term follow-up, nighttime dosing was associated with dramatically fewer cardiovascular events. Same vitamin, same dose, different timing, and completely different outcomes. This explains why so many people take vitamin D for years and see no improvement in blood pressure. They are taking it at the wrong time. Morning dosing works against your biology, nighttime dosing works with it. Now, let me give you the complete protocol. This is the gold standard for using vitamin D to support healthy blood pressure. First, use vitamin D3, never vitamin D2. Second, take a dose high enough to reach optimal blood levels. For most people, this means between 4,000 and 6,000 international units daily. Third, always take vitamin D with vitamin K2, specifically the MK7 form, 100 to 200 micrograms daily. Fourth, take it with omega-3 fat, fish oil, cod liver oil, or a reliable plant-based omega-3. Fifth, and most important, take vitamin D at night, shortly before bed. Make it part of your bedtime routine. Brush your teeth, take your supplements, go to sleep. After 3 months, test your vitamin D level. You want it between 50 and 70. If it is lower, increase slightly. If it is higher, reduce slightly. And always track your blood pressure at home as changes occur. Many people see improvements within 8 to 12 weeks. Now, one important safety note. Never stop blood pressure medication on your own. Always work with your doctor. As your numbers improve, medication can often be reduced safely under supervision. The goal is not rebellion. The goal is restoration. Vitamin D does not replace medication overnight, but when taken correctly, it can reduce dependence on it. This is not speculation, this is physiology, this is circadian biology, and this is supported by real clinical data. If you are taking vitamin D and your blood pressure is not improving, now you know why. It is not that vitamin D does not work, it is that it must be taken correctly. And timing is everything.